Every year, more than 800,000 people have a stroke. But how do you know if you or a loved one is having one? Joining us now is Providence's Kristin Filer to talk about the signs and symptoms that you should know before calling 911. What should we be aware of before we call 911?
Well, you want to know the top signs that someone could be having a stroke. And you, of course, want to call 911 the second you think that someone is having any of these signs, and not just all of them together. You don't have to have them all. One will be sufficient. So the things to look for in someone that is just acting a little bit off, things are just looking a little weird with how they're walking, they're talking, etc. So the top things to look for: speech. They're having trouble talking to you, or they're having trouble understanding what you're saying. That's a big one that people tend to forget, where, grandma just isn't understanding that I'm asking her to go up and get a glass of water. She doesn't quite understand what that phrase means. So that's one really good indicator. Sight is another one that it affects, where you'll see this blurred vision, you'll see double vision, or maybe you can see a loss in vision in either one eye or both of the eyes. You'll also get sometimes a severe and sudden headache, and that can be accompanied by vomiting. You can get dizzy with that, or you can get this altered level of consciousness where people are just kind of in and out of it with this sudden headache. And then weakness and balance, which kind of go together. Those are really, really important ones. You'll get a sudden paralysis with stroke because that blood clot is affecting some part of your body. It's blocking off blood flow getting to your brain. And so sometimes your whole half of your body will go weak, or it'll be completely paralyzed. So you'll see that in sometimes the face or an arm or a leg. So you'll see this, sometimes it's not paralysis, it's numbness, or it's a weakness of it. You'll also see, and that kind of ties in with balance, where there's this trouble walking, the person is stumbling along, they're kind of losing their balance when they don't normally do that, or a sudden loss of coordination. So if you were to ask someone, can you just pick up this water bottle or open the doorknob, and you're noticing, grandma's she can't even open the door. She's not able to get her hand around it. She's not coordinated to do it, and she doesn't have the strength to do it. All really good signs. So to kind of put those together, what we like to use is called this acronym called Be Fast. And it's a quick little assessment that you can just remember in your head to kind of go over, kind of assess someone you think could be having a stroke. So the B in Be Fast is for that balance. Do they have that sudden loss of balance? Is their coordination a little off? Are they stumbling along? The E is for eyes. Like I said, are they having trouble seeing? Are they getting blurred vision? Are they telling you, why am I not able to see something? Why are things kind of black? The F is for face. A good way to assess something's going on is to have them smile, because usually you'll get, a paralysis on one side of the face. Those muscles are not able to hold themselves. So one side can droop because those muscles have just lost it. So have them smile. If one side of the face is smiling, their eye is up, their cheek is up, and one side is just staying put, or it's completely drooped down, really good indicator. The A in Be Fast is for arms. So have them do this little thing where you can have them stick their arms straight out, so they're like this, and then have them hold them in place. Either they'll both start to drift down, or maybe one will drift down and the other stays, because they have weakness there and it's just starting to fall down. They can't even hold their arms straight out in front of them. And then the S in Be Fast is for speech. Have them repeat after you a simple phrase, something like, let's go to the store today. And if they, one, can't understand what you're saying, or two, they repeat it back and they have the right words in there, but it's all garbled. The words are in the wrong area in the sentence. That's what we call word salad. So it's all garbled. It's not coming out right. That's another really good indicator. And then, of course, the T in Be Fast is time, because every single minute counts when it comes to stroke. The longer that you wait, the more likelihood for irreversible damage, and that later in life there's going to be a disability because of the stroke. So calling 911 the second you think any of these symptoms.
That sounds like a life-saving acronym that people should be aware of. So that's really important. Thank you so much, Providence's Kristin Filer.
Welcome.